This is the Respiratory Medications lecture for Pharmacology 2, Mrs. McGhee's class from Collins Career Center. The first few slides that we're going to go over will be talking about some anatomy and physiology, which we went over when we started talking about med-surg. This is in the beginning of chapter 29, mainly pages 594, 595 to 597. You can see that it shows you the bronchial tree, the larynx, the pharynx, the oropharynx, the alveoli. The alveoli are sacs. The respiratory disorders that we're going to talk about include airflow disorders like asthma or COPD, and upper respiratory tract disorders, allergic reactions, motion sickness, and insomnia. This is a fun slide. Shows you some asthma management. It gives you a mnemonic that helps you remember the management of asthma. So the A for asthma means adrenergics. As example is albuterol. The S means steroids, T for theophylline, H for hydration, M for mask oxygen, and A for anticholinergics. So that's an easy way to remember how to treat and manage asthma. This picture shows you what's going on in those bronchial tubes in the airways during asthma. The first tube is a normal tube with no problems. The second tube is just a normal asthmatic without any issues, and then the third is an asthmatic during an asthma attack. So their bronchioles are closed as far as it can be and still get air through. This next slide is pretty extensive. It tells you about the different drug therapy in asthma treatment. There are relievers, controllers, preventers, and combination medications. They're all inhalations. The relievers are short-acting adrenergics or anticholinergics. Controllers are long-acting adrenergics. Preventers are corticosteroids, and combination medications can include 2 or more of the previously listed types. All of these examples I'll give you in class. Airflow disorder medications are beta-2 adrenergic antagonists, inhaled anticholinergics, methotrexates, glucocorticoids, mast cell stabilizers, and leukotriene modifiers. The first one we're going to talk about, of course, is beta adrenergic antagonists. Beta adrenergic antagonists can be short-term or long-term. They prevent exercise-induced asthma and can treat exacerbations of asthma. These examples include albuterol, brethine, and Floridil. Albuterol is our first example drug. It is contraindicated in cardiovascular disorders and diabetes. The side effects include tachycardia, heart palpitations, tremors, and angina. Patient education. Avoid caffeine because of the side effects. Notify when tremors interfere with activities of daily living, and monitor for exacerbations of the asthma. This is not a good medication for cardiac patients. Bronchodilators. Welcome to the bronchodilating rodeo, where we talk about the 3 main bronchodilators: albuterol, brethine, and Ceravans. Albuterol is for asthma, brethine for emphysema, and Ceravan for COPD. They can be toxic to the system, so you need to watch that, and side effects can include increased heart rate, headache, irritability, angina, and tremors. Bronchodilators include epinephrine and albuterol. They both relax smooth muscle and increase respiration through their effects on the beta adrenergic receptors in the bronchi. So they work directly in the bronchi. inhaled anticholinergics, relieve bronchospasms, and are treatments of allergen or exercise-induced asthma. These include Atrovent and Spiriva. The example drug in this case is Atrovent. We need to test for glaucoma. We can give hard candy or water for these patients because they'll get dry mouth. Monitor eyes and O's. Side effects include dry mouth, hoarseness, increased intraocular pressure, urinary retention. Contraindications to this medication are peanuts and soy. Allergies. Glaucoma and prostatic hypertrophy are both cautions. Not completely contraindicated. Just be cautious with this medication. They could increase the problem. So bronchodilators and corticosteroid inhalers. It's really important that you know that bronchodilators should be used before the corticosteroid. You want to open up the airway, open the bronchus so that the steroid can be spread through the lungs faster and uptake can be more efficient. Methylexethanes are long-term management of emphysema and chronic asthma and bronchitis. The example medication in this case is theophylline. Theophylline relaxes the bronchi and the pulmonary blood vessels. Side effects are rare when it's at a therapeutic level, but the therapeutic level, if it's not within that, it can cause toxic effects such as seizures or dysrhythmia. So we have to monitor blood levels. We need to avoid caffeine and nicotine with this medication. And precautions include heart disease, liver and renal dysfunction, pulmonary edema, hyperthyroidism, diabetes, peptic ulcer disease. Now, glucocorticoids can either be inhalation or for long-term management of asthma, by mouth for short-term management or post-exacerbation signs and symptoms, or nasal to treat allergic rhinitis or just regular seasonal rhinitis. And this includes prednisone. Prednisone prevents inflammation, decreases edema, but we do have to monitor some blood levels. We want the lowest dose possible to produce therapeutic effects. Side effects: osteoporosis, hyperglycemia, peptic ulcer disease, and infection. Gastric protective measures need to be taken with this medication. We need to taper it down and not just immediately stop. That can mean that we can end up with alternate day dosing at the end. Contraindications include recent immunization and systemic fungal infection. Prednisone, this little saying reminds you of all the problems it can cause. It says, all the time eating, shaking, bone thinning, weight gaining, bitch making so you can never sleep again medicine. Mast cell stabilizers are for long-term management of allergy-related asthma, or if they're taken nasally, they could be for allergic rhinitis. They can be taken prophylactically, which that would be for exercise-induced bronchospasm and seasonal allergy signs and symptoms. These include cromulin and Tylade. Leukotriene modifiers. They're for long-term management of asthma. Or prophylactically, they could be used for exercise-induced bronchospasm, seasonal allergy signs and symptoms. This medication example is Singulair. There's not a lot to talk about with Singulair. Side effect can be a headache, and you take it daily in the evening for the best effects. Medications for upper respiratory diseases include sedating antihistamines, non-sedating antihistamines, sympathatomimics, antitussives, expectorants, and mucolytics. Sedating antihistamines are used for the management of mild to severe allergic reactions. They can also treat motion sickness and insomnia. Their example medications are diphenhydramine and dimehydronate. The example we're going to focus on is diphenhydramine, otherwise known as Benadryl. Side effects include drowsiness and dizziness, anticholinergic reaction, GI discomfort, acute toxicity, You need to give this with food and monitor while the patient's walking because they could have that dizziness again. The toxicity, to treat it, we would need to give cathartics or charcoal. No alcohol when giving Benadryl. Contraindications are less than 2 years old, a breastfeeding mother, glaucoma, or asthma. Non-sedating antihistamines are for allergic rhinitis, chronic idiopathic urticaria, which we all know is my favorite word for hives. These medication examples include sertrazine, loratadine, and fexofenadine. We're not going to talk about any specific medication because they all are kind of the same with this group. They cause drowsiness, fatigue, mild anticholinergic effects, which you can find on page 3, defined in your reading assignment. They're not supposed to be given with other over-the-counter allergy medications. They want to lower the dose with liver or renal dysfunction, and they're contraindicated in people less than 6 months or breastfeeding moms. Sympathomimics reduce nasal congestion in allergic rhinitis, sinusitis, and the common cold. Phenylephrine and pseudoephedrine are examples of this type of medication. Sympathomimics are PRN medications. You need to report prolonged tachycardia or palpitations to your physician. Contraindications for these medications are chronic rhinitis, glaucoma, heart disease, hypertension, or dysrhythmia. Rebound nasal congestion can occur if your body gets used to this medication, so they only recommend that you use them for 3 to 5 days at a time. They are addictive for your body. So the definitions of antitussive, expectorant, and mucolytic. Antitussive is used to prevent coughing. Expectorant promotes coughing and gets that sputum to move around and get out of there. And then a mucolytic actually breaks down really thick mucus so that you can cough it up and get it out of your respiratory tract. The way that antitussives, expectorants, and mucolytics work is explained on this slide. It tells you that Tessalon is an antitussive and it decreases coughing. And then the second one it talks about is Robitussin. It's an expectorant and it increases mucus release to create a productive cough and get that stuff out. When the mucus is really thick, then bacteria start to grow. Bacteria equals a pneumonia. It also gives you some signs and symptoms of adverse reactions and side effects to watch out for. Antitussives suppress a chronic non-productive cough. That's the key, non-productive. They can be opioids, dextromorphan, or Antitussives should be administered with food or milk, but you need to encourage high fiber with their diet. They are PRN medications, but you want to use the lowest effective dose because they can cause the side effect of CNS depression. Expectorants such as Mucinex are used for colds, upper respiratory tract infections, and bronchitis. Mucinex thins thick mucus. We need to give it with food or water. There is a risk of hemorrhage when given with heparin. Contraindications include a cough related to heart failure. It's not going to cure that kind of cough. Or ACE inhibitors. Side effects include dizziness, GI distress, drowsiness, and allergic reaction is possible with this medication. Mucolytics are for bronchopulmonary diseases, cystic fibrosis. They can also reverse a Tylenol overdose. This medication is called acetylcysteine. Acetylcysteine is also known as mucomist. It has a sulfur-like odor. The contraindication is GI bleed, and it can cause effects such as bronchospasm and GI distress. Thank you for hanging out with me, and this wasn't too much of your time. Remember to read your reading packet and add on to your notes for this PowerPoint. Thanks.